The information presented in this podcast is for educational purposes only and is not meant to be a substitute for clinical mental health treatment. If you or someone you know is experiencing a mental health crisis, please dial 988 or head to your nearest emergency room.
Welcome to the Black People Die by Suicide 2 podcast, where we discuss all things mental health with an emphasis on suicide in the Black community. I'm your co host, Jordan.
I'm your co-host, T-Kea.
Welcome to another episode. I hope you guys are doing well. Hope you guys are out there thriving. So, when we start all of our episodes, we like to do a check in, really get in tune with how we're feeling, how we're doing, because too often we say that we're fine or we're good, and we are not fine or good. What does fine stand for again?
FINE stands for feelings I'm not expressing.
Yes. So we really want to tap into how we're doing. How are you doing, T-Kea?
How am I doing? I'm doing well. I'm doing well. I have some things that I am working through, um, but I am also very hopeful and I'm looking toward the future and just determined to push past all obstacles, fears, and anxiety.
Nice. I don't know how I'm feeling. I'm feeling that's a shame. Like I didn't know this was gonna come up. I'm feeling a little sad, but I'm gonna get through it. It's just a lot, I guess a lot going on for me, trying to keep up with my depression. I neglected to do a lot of things. I might have mentioned this before in a previous episode, but I really put a lot of things on the back burner and it's all kind of coming back to the forefront. I'm just trying to push through and get through everything, cross stuff off my list one at a time. It'll get done. I'll be all right.
Yes. Yes. So that means we're jumping into the topic.
So, for today's episode, we are really excited. We are talking about our experience being peer recovery coaches, peer support specialists. We go by lots of different names and titles.
Community health workers,
Yes.
recovery coaches. Yeah.
Yes. So, a peer support specialist is an individual with lived experience with either a mental health disorder, substance use, or both. And we take our recovery experience to help other people that are still in the midst of their struggle.
Mm-hmm.
And I have to say, it's a really rewarding position. We're finally getting our pats on the back.
Right.
We're finding our way into, healthcare and treatment. We're yeah.
Yeah. And you know what? I didn't even know what a peer specialist was. And I don't even know how I stumbled upon it as like a career choice. Because before I was in the mental health space, I worked um, as a freelancer. So I did a lot of cool projects and I did like the BET Awards, the Soul Train Awards, NAACP Image Awards, Black Girls Rock. Like I was doing a lot of in the entertainment like event space. And when I had my mental health crisis, I was like, I really want to find a way to kind of get into the mental health space because it was something that I was becoming passionate about that I wasn't passionate about before for obvious reasons with my experience with my own mental health challenges. And I stumbled upon it some kind of way, not sure, but I knew that I did not want to be a therapist. And I think we'll talk about how, as peer support specialists, how we differ from other mental health professionals. But I knew that I wanted to make a difference in the lives of other people. I found that when I would write my articles online and people would like respond and comment, and I was like, wow, I really I like connecting with other people. Um, Helping other people know that they're not alone, but also helps me realize that I'm not alone in my challenges and my struggles. And so peer support specialists are great because we get to work one on one with individuals, but we also get to lead support groups. And I feel like I do like working with people one on one, but I'm a group support kind of person. Well, you are too. and and I've been able to work with peers and help them to reach so many of their recovery goals, like helping. I worked a part of a research project for a nonprofit, and it was partnered with the state of Maryland. And I helped peers work their way off of Social Security benefits and to find like self sufficiency, because a lot of times when people get Social Security benefits, it's very scary to come off of
Mm,
that and to not have that as, I guess, like a security blanket.
right.
But there are peers that I've worked with where they've gone back to school, they've gotten degrees, they've worked their way off of benefits, and they're living like thriving, lives. And I often wonder, like, if I would have had a peer, I feel like I probably would not have had a suicide attempt, because the thing is, even if my therapist had depression or bipolar disorder or anxiety or whatever, it's against their code of ethics to disclose that they have any mental health challenges, because mental health professionals, social workers, therapists, counselors, psychiatrists, they are trained to make it about the patient, to make it about the client, and there's just boundaries that they can't cross. But the great thing about peer support specialists is that we know when to share our story when it's appropriate, because it does help provide a sense of hope in that recovery is possible. And I feel like if I would have had somebody to say, like, I've been where you are,
Mm,
and to kind of look at as like a role model or example, because I remember when I was working at a mental health treatment facility and I was leading a support group, and I had shared that I was, hospitalized for a suicide attempt. I was, I'm a Christian, and like the things that I was told in the church as it relates to mental health, and just kind of sharing that. And then there was one of the patients that was like, "Oh my gosh, I'm so glad that I came to your support group today, because I finally feel seen, heard, and validated. And I want to know how you made it to the other side, because just you being in a space where you're disclosing and sharing your story." She's like, "Now I have some hope that I can get to the other side." And I feel like that's the beauty and the power of peer support.
yes, and I think it's very beneficial to have us, incorporated into the medical field and the recovery field, because there's a benefit to having someone who isn't in a role of authority
Mhm.
telling you that, oh, you should stop doing drugs, oh, you should, um you know you should be taking your medicine. It's different when it's someone who is like a doctor or a nurse or someone that we look at again as a position of authority, telling a patient what they should do. When we come into the room and we talk with them, we basically meet them where they are.
Yep, we don't tell people what to do.
No, we're not licensed to give advice. We don't write scripts for medicine. We don't, um, we refer people out to services. We provide services. We're definitely a good link between, I guess, licensed mental health professionals and the community. We're just lived people that have basically been through some of, the same things, similar things, and helping sharing our story to encourage people to change their lives. And again, we meet people where they are. We listen to their stories. No judgment.
Judgment free zone.
Yes, we don't judge anyone. We really do sit down, talk with people, meet them where they are, and just encourage them to change their behavior.
Yeah, and I think too, like with this motivation, like interviewing. So we'll help people, if they ask for advice, like, what should I do? We do not give them advice, but we will help them work with them to, like, I've like helped peers. They would be like, do pros and cons lists. So
Mm-hmm.
I've worked with peers and we've kind of do that. Or I've also helped peers come up with RAP plans. So
Mm-hmm.
like wellness recovery action plan. I've worked one-on-one with peers, and essentially it's a wellness plans that help you to get well and or stay well. And so I've helped them in terms of what getting them help them to define what they want their recovery to look like. So as peers, we do help individuals reach their goals as it relates to their mental health and or substance use, um, recovery. And so I love that because it's also like having a cheerleader, a mentor. Peers, we do mentorship, we do coaching. And so that's really how it kind of we differentiate ourselves from clinical or licensed mental health professionals. And I have found it to be so rewarding. It's like one of the best feelings when someone comes to you and say like, hey, I got that job, or I got this credential, or like, because when you see people when sometimes when they're at their worst, and then when you see them like bounce back, or I don't even want to say bounce back, but more so just have this new excitement and have goals when before they didn't want to live. It's just like so refreshing. And to think that while I was able to help and be a part of that process, and it also reminds me of how far I've come. And it makes me think to myself, like, wow, Tahia, I never thought in a million years that I would be doing the peer work and all that I'm doing in the mental health space. But it's like, wow, it just shows that it can get better, even though there are moments where you feel like it won't get better.
Yes. And it's powerful because with peer work, T-Kea and I have different experiences in that her peer work was more on the mental health side, and my work was on the substance use side. I actually don't have any lived experience with substance use at all. Okay, outside from like the occasional drink. Um, but I actually ended up getting a job on the substance use side because a lot of people that use substances actually have like an underlying mental health issue going on. Not everyone that uses a substance has a diagnosable mental health disorder. I'm not saying that, but I found that the people that I work with, almost all of them have something going on. So some people will use substances to help mute voices that they may be hearing, auditory or visual hallucinations that they may be experiencing. So sometimes the substance use is really just self medication. A lot of people have had similar experiences for me in terms of, trauma, in terms of depression. So I could always relate, even though I didn't personally use substances.
Mm-hmm.
And again, it's super rewarding. Being a peer on the substance use side is broken down into a lot of different areas now. I was a peer at an inpatient substance treatment center. I also did peer work in the emergency room. There's a lot of peers for substance use in community based organizations as well. They're even starting to put a lot of them in like OBGYN offices.
Mm-hmm.
I noticed there's a lot of pregnant women services. There's peers in drug courts.
And even behavioral health or psych units
Yes.
at the hospital, there are peers now
So we're really starting to like really
to
take
pop
off.
up.
Yes.
Yeah, yes, definitely. And I'm always encouraging people to kind of consider it as a career choice. Um, but even too, in terms of peers, so there are sometimes you will encounter that when you work as a peer support or peer recovery specialist, that people will feel like mental health professionals who are licensed or they have they're licensed clinical social workers, or they have their psych D or their PhD. Sometimes they will feel like peers are like so beneath them, like, oh,
Mm-hmm.
what do you have? You don't have anything. But let's be clear that peers also have a credentialing process that they have to go
Right.
through as well. Um, and for me, I know it took me like 2 years, and every state is different, So we're in the state of Maryland, but I know for Maryland, I had to take um, trainings in order to get my continuing education units or CEUs. And I can't remember how many I had to get, how many hours I had to get, but I had to get quite a few hours. And then after I took all of my trainings, I had to get a supervisor and then get supervision hours so that they can supervise me as I'm learning to work with peers. And then after I got my supervision hours, then I had to take a test, and it took me like 2 years to like go through that process. And so, but even outside of that, that's And I took, trainings. We take trainings on trauma informed care. We take training on ethics. We also have taken training. Of course, I took mental health first aid. I took rap,
C-car.
CCAR. I took trainings on the different types of trauma. I have taken so many mental health trainings that I have lost count of how many. And the trainings that I have taken have been evidence based. It's not like something people just wake up and pull out of their hat, but whatever. I don't know. But all that to say that it is a process. And so, I have found that I've never had anybody look down on me, but there have been stories that I have heard where people, because especially for people sometimes who have struggled with addiction, there was a peer supervisor that was saying that she has heard people say, like, oh, well, they're just, like junkies, or like they don't really know what they're doing. They don't have any schooling or anything like that. But that's not necessary. That's not true. And so I don't know what other trainings. Can you speak to maybe what some of the trainings that you've taken?
So I've done a lot of, there's been peer trainings for specifically people that are working in the residential side of like substance use treatment. So I took almost like a house manager kind of training.
Mm-hmm.
I've done that before. Like you mentioned, there's CCAR. We also have to do ethics. A
Yes.
lot of it actually does cross over between, the mental health and the substance use side, but there are definitely ones that are more specific to mental health. I'm sorry, substance use treatment, because it's a little bit different. Um, and I'm with you on that for sure, because I've worked in the emergency room and I feel like I've been looked down upon as, oh, that's just the peer recovery coach. Like, what can they really offer? What can they tell a patient that I can't tell a patient? And I'll tell you, sometimes it's really as simple as having a conversation with someone. We're able to look at people like people first.
Mm-hmm.
I've definitely experienced or witnessed uh, medical professionals treating people like, oh, that's just a junkie. You know what I mean?
Mm-hmm.
That's just an addict. They're just
And
going to shoot up. Like, it's almost dismissive. I'm like, you're wondering why people aren't being receptive towards you. Sometimes it's as simple as having a conversation with them.
and you know what I want to say? The great thing about peers that we are great advocates for each other.
Yes.
Like, I have advocated and I have been in meetings with, which is mind blowing to me, with psychiatrists and therapists. And I'm grateful the spaces that I've been in, they actually want to hear like what I have to say. Like, T-Kea, what's your, how do you think we can best support? Like, I'm actually even currently doing some consulting with a research company, and they work a lot on government contracts, and they are getting my I'm basically doing peer support consulting, and I'm grateful because it gives me a opportunity to advocate for people who are too afraid to advocate for themselves, or they haven't found their voice, or they're afraid for whatever reasons. But yes, peers are great additions to the mental health and substance use space because it shows that recovery is possible. And I don't necessarily mean, and I know when we say recovery is possible, I often think about, I don't know if we actually, in terms of recovery, if we go back to who we were before, but I think
Mm.
when I think of recovery, I think of defining what I want my new life to look like, because I don't actually want to go back to who I was before I
Right.
had my crisis, because that's ultimately what led me to a crisis. But I I, I often, as a peer, I have learned that there is power in having a support system, and as being a peer, we're part of a community of literally millions of people, that have been open and honest about their struggles. And think about it, because even before it was called peer support, on when the people who have struggled with alcoholism, people were going to AA, and 12 steps. That's peer support, and
Yes.
it it works
Yes.
for many people, not all, but it does. It works. So peer support is so powerful and so valuable.
It's very hard as a peer recovery specialist on the substance use side because you will watch people pass away. And when I worked at the residential center, there's been several people that have died from overdose after leaving the program. And I think about them all the time, all the time. The conversations that we had, and that they were people with hopes and dreams.
Mm-hmm.
And they would tell me about, what their plans were after they were leaving the program. Some of them wanted to go back to school. Some of them had children. They wanted to take their children on vacation. Some of them wanted to start businesses. Like, they were people. And I keep their memory close to my heart. The issue of substance use and mental health disorders can be deadly, whether that be through suicide, whether that be through overdose, even complications with substance use. You can get a lot of skin infections, say, for example, if you um, inject drugs, or you can get sick, your liver, if you consume a lot of alcohol. There's a lot of complications. And in the hospital, I definitely saw people at their worst. And there was nothing more rewarding than the days I would come to the hospital. It's one patient I'm thinking about in particular. I remember they would come, like, shoot, at least like 3 times a month. And I remember that I helped this person get into a treatment program, and I didn't see him for months. I didn't see him even when like, right before I left the hospital, I didn't see him anymore. So I'm just going to hope and pray that it was because he went to the treatment center and he got better. Um, it's it's definitely not for the faint of heart, but it's 100% rewarding to see people just completely transform, because I've seen it time and time and time again. And substance use is something that is difficult to overcome. It's not as simple as, oh, that person should just stop drinking, that person should just stop using the substances. It's definitely a process, but I've seen people do it over and over and over again, and it's rewarding.
Yes. And even talking about, like, let's pull up the stats from SAMHSA, okay? That peer support has helped to decrease mental health symptoms. It's been shown that it helps to lower substance use. It increases social support and social functions, because a lot of times people feel like, I am alone, no one understands me. It also helps to increase self care, empathy, acceptance, inspiration, and hope. Like, oh my gosh, hope is so important,
Mm-hmm.
because when you are in the dumps and you feel like you don't want to live, you feel like there is no, that you're trapped, nothing is going to make you feel better, and you just want to, like, die. Like, to be able to instill hope in someone is life changing, because it saves their life. And it's like, I'm just getting so emotional thinking about it, because I remember the days I didn't have hope and the days I wanted to die.
Yep.
So the fact that I, as a peer support specialist, I can give that to someone is like, it it just means so much to me. And I am up here because I want to be the person that I needed when I was in my darkest days.
Mm. Yes, I like you. I definitely wish I would have had a peer support specialist there to help me. There's a lot of value in just having someone there who understands, because
Mhm.
we often feel like, oh my gosh, nobody else is going through this.
Right.
Or if we were people that felt comfortable enough to approach people and let them know what was going on, sometimes we don't always get a positive or helpful reaction from that.
Mhm.
So it's always great to have someone support us, even at our lowest. Makes us feel human, makes us feel alive. It gives us hope, like you said. And that hope goes a long way. I'm telling you, it will really transform someone's life. And that's why, being a peer is so great.
It really
We need
is.
more people.
Yes, we do need more people. And even in terms of peers, has also helped to, like, reduce hospitalization,
Yes.
because people are, they're engaging with peers, like, in community centers. There are even peer, like, wellness centers as well. They're popping up, which is why I decided to start the Mental Health Empowerment Agency, to be a place where peers can, we can have support groups, work one on one with peers, and simply, again, like I said, just be the person that I needed in my darkest days. So that's why I decided to be in the field. Now, depending on where you work and what, what state it is or what type of facility it is, the downside to some places is that they don't pay peers a lot.
Mm-hmm.
um there are some, depending on if you work for the government or things like that, where you can get a nice salary. And so sometimes that can deter people from pursuing peer support specialists or recovery coaching. Um, I'm an entrepreneur, so I work for myself, so it's a little bit different, but I am still credentialed in the state of Maryland. But that can be, it can be discouraging for some people as well. But I think it's just also finding an organization
Mm-hmm.
that you can work with and that you feel like you're getting, you know, paid what you feel as though you're being paid, what you, I guess, you feel as though your value is, but you're also getting other things outside of pay too, like
Yes.
professional development, like building your network. Like, I have met so many people,
Mm-hmm.
like, in when I worked for a nonprofit. I worked also for behavioral health. Like, I used to work with Shepherd. I used to work for Shepherd Pratt, and I also have been a patient for Shepherd Pratt.
Me too. Me too.
so so to be able to, it's like, it's just it's so interesting because, like, so I've been a patient at Shepherd Pratt, but I've also worked for Shepherd Pratt. Jordan has also been worked at the hospital that she went in
Yes.
for mental health treatment. So it's very interesting how, like, life has become full circle. um but yeah, there's so much power in peer support, and so I'm hoping that I will be able to continue to grow my business and what I'm doing with the Mental Health Empowerment Agency and what we're doing with the podcast and everything, because especially for us, I think I work with everyone, but I do my best to also make sure that I um, have moments where I'm focusing on the Black
Mm-hmm.
community, because oftentimes we're neglected.
Mm-hmm.
That's why a lot of times we have to create our own space for things.
Right.
And so for me, while I do serve everyone, there are events or activations that I will have that focus specifically on the Black community. And because I do pride myself as being one of the face of what a mental health condition can actually look like, because you can't look at me and tell me that, you can't look at me and be like, oh, she has bipolar disorder. And so I think it's important that Black women and just people in general see someone who looks like them, that
Yes.
has challenges that they can relate to, and see that they can actually get to the other side.
Yes. There's a lot of value in being able to connect with people in your community. That was the one thing I did really like about working at the hospital. Again, I worked at the same hospital that I was a patient with. I worked alongside,
The hospital we met
yes, the hospital we met at.
at.
I worked alongside the same people that gave me treatment, and I can't tell you how good it felt to give back to people who lived in my same community and who looked like me, um, and trying to provide them services and get them connected where they can receive treatment and improve their lives. And it was just so rewarding. it's
Hmm.
it's so important that we have people who understand and people that can empathize with us. So
Yeah. And my goal is, like, is even with my business, is building, like, right now I just do work virtually, but my goal and my vision that I have is even creating like a physical peer center
mm,
that people
mm-hmm.
can come in and get services, because like a lot of the support groups or things that I do is all virtual, but I do have a vision in terms of eventually getting to a physical space that people can come to is nothing but peers. And I just really to be integrated, because I'm always going to push therapy until the day I die,
Right.
because I believe, I know when you get a good therapist, how life can just really change for the better. I
Mm-hmm.
have an amazing therapist. We all know Dr. T, she's been vital in my recovery. But I also know that I could have benefited from a peer as well. You can have your therapist, your psychiatrist, or your social worker or your case manager, um, and a peer, or some people may have a sponsor.
Right. Yeah.
So, but like just having different types of support is so important because one person can't be the only support that you have. Like you have to get different types of support. So like I know medication management, I have to get that from my
Right.
psychiatrist. But I know peer support, I can get it from Jordan. So I it's just so important because it's impossible to get everything from one person,
Right.
and that's the beauty um of having a peer.
Right. And having a treatment team in general.
Yes.
They all can kind of work together to take care of all of your needs, and that's so important.
Yeah, and that's why peers are definitely now are becoming a part of treatment teams
Yes.
because they see how the value that we bring. So, yeah, we just thought it was important to just kind of talk about because people always ask me. My mom said that somebody asked her, "What does T-Kea do?" My mom said she responded, "What doesn't she do?" She said, "I can't list everything that she does."
That is so funny.
But she's like, she do a podcast, she speaks, but um one of the most rewarding things that I have done in my career is the peer support work. From the research projects that I've worked on to working directly with peers, whether it's in the support group or a one on one or it's a great feeling to be able to help people get out of their darkest moments.
Yep.
And it's like just a coach, in terms of like some people have life coaches,
Right.
but there are also peer coaches or recovery coaches that really provide value in terms of being able to identify and use their lived experience. And so like for me, when I'm working or have worked with peers, it's important, like, we don't make it about us, but we will, like, for instance, if there is a particular topic that we may be talking about in a group setting, and I may share something related to that topic, but then after that, I really just leave the space open for other people to share
Hmm.
because it is important that even with being a peer support specialist, you don't want to make it all about you.
Right.
So you have to really, we're trained to gauge when it's appropriate and when it's not appropriate to share. Um, and so I have found that it's, like I said, one of the proudest or one of my best accomplishments is being able to support others in their recovery journeys.
Yes, and you'll find that people are so open to sharing after they
Mhm.
find out that you're open.
Yeah.
It kind of creates like a two-way street. Yeah, definitely one of the most rewarding things I have ever done. I absolutely love it. And I think, for today's resource, if you're a person that with lived experience with a mental health disorder or substance use and you're in recovery, and you're considering like, oh, I should check out this peer recovery, definitely Google your state and peer recovery, and I'm sure something will pop
Something
up.
should come up.
Yes, any type of like requirements. There might be like a centralized program. I know DC kind of has that for all of their peers. So it's something that you should consider. Definitely Google your state and peer recovery, and you'll be surprised what you'll find. It's definitely space out here for us. We're really making waves in the healthcare field, and we need more people.
Yeah, we do. I
We really
mean,
do.
it depends on your state. They may call it recovery coach.
Right.
They may call it peer support specialist. They may call it peer recovery support specialist, but just kind of play around with those keywords and put like credentialing or license, and the requirements should come up because I know there are. It varies from state to state. I know North Carolina has how they do theirs. DC has how
Right.
they do theirs.
Right.
Maryland. So, um, but you will definitely learn a lot. And for me, it was no easy process. It took me almost 2 years
Mm-hmm.
to finish, but I'm so glad that I did because I learned a lot. And I continue, like me and Jordan still take trainings now
Mm-hmm.
in terms of so we can make sure that we're staying up to date in what's happening in the mental health, substance use, suicide prevention and awareness space to make sure that we are not just speaking from our experiences, but we're also speaking from, having the educational background as well.
Right. Yeah. Actually, this year, for another resource, I took the NAMI Peer-to-Peer finally. I've been trying to get into one of these classes for a while, but I took my NAMI Peer-to-Peer, and that was really great. It teaches you a lot of skills that will be applicable for you if you are interested in becoming a peer. Um, we met like every Monday for 2 hours. I think is it 6 weeks or 8 weeks?
One of the two.
I think it's 6 weeks. So I did that and I got my certification this year from NAMI. So I thought that was great. And in case you don't know, NAMI is the National Alliance on Mental Illness. So definitely check out, see what's out there for peers. It's a lot of information, and we would love to have you join the army with us.
Yes. NAMI Peer-to-Peer. So definitely check it out. If you go to their website, um, it'll you you will then go to the one in your state or your county, and then they have peer-to-peer programs, which is great. I Jordan did it. I've done it. So not NAMI is a great organization. So definitely check it out.
So for today's spotlight, we're going to highlight actually an organization this time, and it is the Tide That Binds, and they're an organization here in Baltimore City. The founders are Wendy Davis and Tanya Richardson, and they provide a lot of services, especially for substance use. Baltimore actually has quite a few programs that will, get into substance use, and the Tide That Binds is one of them. They provide a lot of resources in the community. You should definitely check them out. Their website is 3tb.org. That's the number 3, the letter T, and the letter B.org.
And they're a peer ran organization.
Yes.
Yes. And Wendy and Tanya is amazing. I took their CCAR ethics training, and I also took a trauma informed care training with them, and it was great. They're down to earth. They are share their lived experience, and they're super engaging. I had a great experience taking training with them, so I definitely felt like shouting out peer ran nonprofits and just organizations so that people can know that there are people that are similar to them that can also help them outside of a therapist and a psychiatrist. So, um, you took my spot because I was supposed to do community changemaker, but it's okay. I'll do the spotlight. Yes, okay.
Okay.
It's okay. I'll do the spotlight. So for the spotlight today, we are spotlighting the founder of the co-host of the Soul Train, which is Don Cornelius. I had no idea that he died by suicide. I feel like maybe I did, but I forgot. But just to see somebody that was so brought so much joy to to Black culture and to music, and you think about like, oh my gosh, this person could have all this money and they have all this fame, and you look at people and you look at attach them to their education or their socioeconomic status, and you think like, oh, they like everything's fine for them. um but he died at what, 76 or something like that, 70 something.
75.
He died at 75. And so just to imagine how much, we don't know how long he was struggling
Right.
that eventually led to that point, but definitely taking this moment to pay homage to him and what he's contributed to Black culture, and how he's really helped change the lives of people. And yeah, so rest in peace to Don Cornelius, and thank you for, all that you have done.
Yes, he's contributed a lot to the culture. I love me a good Soul Train gift.
So now we'll jump into self-care. So what we are doing or what we plan to do, I'll let you go.
Yes, so I am planning to get me, we're going to be going to New Orleans soon. And I am planning to get me a hot beignet. I'm so excited. I'm going to take that as self care because we deserve to cheat every now and again. You know what I'm saying? We deserve to have our little snack. And
You know what? I'm gonna get you, because I don't look at things as cheating. I just look at it as, We just have to learn balance. And that's the
Okay.
issue that a lot of us have, is that we're eating too much of the sweets or the salty things or the fried foods. I don't look at it as, I don't tell myself I can't have something, because it's like if I want it, I get it, and it's like I'm cheating on food. I don't feel like I'm actually cheating, because cheating would mean that I'm not supposed to have it.
That's a good point. That's a good
So
point.
you're just enjoying it. And I think I saw this thing on social media with some nutritionist, and said there are some foods that give us a lot of nutritional value, and there's food that do not. We just have to simply learn how to find the balance in that, and it's okay. So that's why I don't be like, I guess yes, technically I'm vegan. So you'd be like, you shouldn't be. Well, that's just the diet that I choose to follow. But yeah, I think we should change how we look at food. And I feel like that's a whole nother episode. But like, just definitely change and say like, no, I'm just enjoying myself. Like, yeah, you've been doing great. Like, you've been getting your water in, and you've been being more intentional. So I think the goal that I feel like we should work toward is having balance in our diet, not depriving ourselves.
You see, this is why you need a peer, because they can help reframe some things for you. Thank you, T-Kea. What are you going to be doing for self-care?
Self-care. Who what am I going to do for self-care? What am I going to do? I'm doing for self-care. I'm going to Essence Music Festival
Yeah.
with Jordan. So we will be there. I am excited about that. So I feel like that's something that I'm doing for that's like a big self-care thing. You know, we have small things that we do every single day for self-care, but that's like a something on a bigger scale in terms. So I'm looking forward to networking and promoting the podcast, because you know T-Kea wears the podcast shirt everywhere she goes. So yeah, I'm excited. That's something that I'm looking forward to.
Sounds like fun. I can't wait. Never been to New Orleans. I'm excited.
Me either. So this is gonna be the first. So, and I guess we just have our last segment that we have to go
Yes.
through. That
Moment of
you? Or that me?
inspiration.
Is that me, or is that you? You can do the moment of inspiration.
Oh, yes. Okay. You might have to, because I can't read.
Oh, you can't read it from over
I
here.
thought I could read
Oh,
it.
it's okay. So for our moment of inspiration, since we are doing we this episode we talked about peer support and the power of peer support specialists. There are two quotes that I want to leave us with that we pulled from um, SAMHSA. And these were people who have worked with peers. They have said, Melodie has said, because of peer support, I am alive. And that really struck a chord with me, because I I know that I've worked with peers and have helped to save some peers' lives. I've worked with peers in the inpatient unit. I've worked with peers in community centers. Like the power of peers is just so important. And to be able to help save someone's life just by using your own story is so powerful.
Yes.
So, for the moment of inspiration, we want to leave you with this quote, which was said by a peer, and it's, because of peer support, I'm alive. And I love that because it resonates with me in terms of, I believe that if I would have had a peer support specialist, it could have potentially prevented me from attempting suicide, because I would have been able to work with someone who could have shared, like, oh my gosh, I've been where you are. I've attempted, or I've struggled with suicidal ideation, and kind of looking at them as a role model and a coach. I think it would have instilled a lot of hope in me. And that's not saying that Dr. T didn't instill hope in me, because she did, but what I get from my therapist and what I get from you are two different things. And that's not to diminish my therapist or Jordan. It's just I get two different things, and it's so important. And so peers are out here saving lives. And so I just think it's important that we were able to shine light on what peer support specialists do and the value that they bring to the mental health or behavioral health and substance use system.
Yes. So thank you guys for watching or listening.
Yes.
And we will catch you guys on another episode.
This episode was sponsored by the Mental Health Empowerment Agency, where its mission is to dismantle the mental health stigma and raise awareness of suicide prevention through curated events, individual and group peer support, digital and social media, and educational trainings.